Pathology, chronic inflammation. All right, so we already discussed that what happens after chronic or after acute inflammation is that the macrophages come in, they clean up the area, and they start to scope the area for any additional issues that might present later on. If they find additional issues, they can lead into chronic inflammation, okay? And so once again, the main mediator of chronic inflammation is going to be our macrophages, which will then call in lymphocytes and plasma cells to the location in order to help the response of the immune system, okay? We're going to talk about this here, but there are going to be some topics that are going to be kind of talked about in immuno, which will be much more helpful to see the full picture. Now, persistent infections are the number one cause of chronic inflammation, right? So if we have persistent infection of maybe TB or syphilis or any type of fungi or virus, we usually are going to have chronic inflammation, okay? And this can lead to a type 4 hypersensitivity, and ultimately autoimmune diseases can cause chronic inflammation and other things like that. Now, once again, macrophages are the dominant cells or mediators of chronic inflammation. And the reason behind this is because they have the ability to help activate T helper 1 cells or T helper 2 cells, okay? So Th1 and Th2 cells are very key to understanding what's going on in the full scheme of things, okay? And I'm not going to go fully in depth here. Immuno is going to cover this, but just know that macrophages help with the differentiation of Th1 cells and Th2 cells, okay? These type of lineages. Th1 cells secrete IFN gamma, okay? And that IFN gamma leads to macrophages to be activated. Okay, so what happens is our macrophages are going to activate Th1, and Th1 is going to produce more IFN gamma to help produce more macrophages in order to help with chronic inflammation. These are pro-inflammatory responses. Th2, on the other hand, it secretes IL-4 and IL-13 as well as IL-10, and they're going to help with repair and anti-inflammation. Okay, it's an alternate activation, but these are anti-inflammatory. Okay, so those are the two cell lineages that might be activated depending on what's occurring. Once again, macrophages are the key cells involved. Th1 cells are going to be pro-inflammatory. Th2 cells are going to be anti-inflammatory. Okay? Very key to understanding it all. Next is going to be wound healing. Wound healing is an important topic when they're talking about any pathology. Okay? They love to discuss it. Now, first and foremost, you have to understand what TGF beta is. TGF beta is just a healer. Okay? So it's going to be anti-inflammatory. Okay? They usually say it, I guess, in association with IL-10 because IL-10 is also an anti-inflammatory leukotriene. So what you have to know, or interleukin, I'm sorry, I misspoke. But what you have to know about TGF beta is it does the same thing. It causes the relaxation of the inflammatory response, but it also leads to fibrosis. So if we have constant injury and the TGF beta comes in, it's going to lay a layer of fibrosis on top of that injured area, and it can constantly occur leading to some type of pathology, which we'll see later. But for our understanding right now, TGF beta is associated with attenuating that immune response as well as fibrosis. Next is VEGF. VEGF stimulates angiogenesis and production of new red blood cell or new vasculature. PDGF is platelet and macrophage production, which is what you need to know. Metalloproteinases is going to be copper and zinc, and it's helpful for tissue remodeling, which we'll see in a second. Okay, so that's all for the tissue modulators. Now let's talk about actually what goes on in wound healing. So first off, we need to talk about the types of tissue. So there's labile, there's stable, and there's permanent. For labile, we have continuous regeneration. That's what that means. Okay, so the first type is labile. It's going to be continuous regeneration, which is going to be our skin, our bowel, our bone marrow. These have increased number of stem cells in their basal layer and in their crypts. Okay, so they constantly regenerate. Next is stable. Stable, it can regenerate, but it's not constant. It's not continuous. Okay, so they're staying in their G0 spot. Okay, until they need to regenerate and then they'll re-enter the cell cycle. Okay, this is known as quiescent, and the one organ that we really need to know that does this is the liver. So they stay in their G0 stage until they need to regenerate, and then they'll go back in. Permanent, they're stuck in G0. They cannot re-enter the cell cycle. Once they're produced, they can only repair. There's no regeneration. And that's why we get scar formation. Okay, so scar formation occurs when there's no ability to have those stem cells re-enter the cell cycle. We're going to see the type of organs as the heart, the skeletal muscle, and the nerves. Now, you might ask me, Nate, if the skin is labile and it's continuously regenerating, how do I have scars on my skin all the time? Well, what did I say? It can be seen, scars can be seen in labile tissue if you if you go deep enough to the basal layer where the stem cells are located. Okay, so it just depends on whether the stem cells are present or not present. All right. Now, the phases of wound healing. Now that we talked about the types of tissue, let's talk about the phases of wound healing. So first, I have a wound. Boom. Day 1. Okay? Or hour 1, let's say. We have an immediate inflammatory response. Okay? From day 1 to day 3 after the wound, we're going to have an inflammatory response. And that's going to be due to that neutrophils, right? Neutrophils are the main thing that's going to be migrating towards that area. And we already talked about how they get there. They're going to clear up all the debris. They're going to cause pus. They're going to cause all these issues. And then after day 3, we have the proliferative phase, where we have macrophages coming in. Macrophages come in, they clean up the area, and they're going to release these cytokines, which bring in, they start to release VEGF, okay? And VEGF stimulates angiogenesis, which brings in new blood vessels, and fibroblasts come via the blood, and they start to lay down this thing known as granulation tissue, which is type 3 collagen. It's weaker than the type 1 collagen, okay? But it still is able to protect that area somewhat, okay? Now, if we have a delay in second phase of wound healing, that means that we have maybe a potential of vitamin C or copper deficiencies, because vitamin C is important for hydroxylation of collagen, and copper is important for lysyl oxidase of copper, which we'll talk about in biochem. But those are very important for wound healing. So if there's a vitamin C deficiency, we can't hydroxylate our collagen, leading to a delay. And if we have a copper deficiency, we can't use lysyl oxidase for our collagen, and that's when we have a delay as well, okay? So that granulation tissue, type 3 collagen, is next put down. Lastly, we have the remodeling phase, okay, 1 week to however long, however many months. And this is mainly done by fibroblasts. The fibroblasts, they come in, they change our type 3 collagen and replace it with type 1 collagen, which is stronger, okay? And we need collagenases in order to break down the type 3 collagen, in order to place the type 1 collagen down. So that's why we need our zinc, as well as copper, which are metalloproteases, also known as collagenases. Those are the same thing. Collagenases and metalloproteases are the same thing, in order to break down collagen so that we can place down the collagen type 1. Okay. We also see collagenases being used by tumor cells in order to break through the type 4 collagen and enter our systemic system circulation, but that's another topic for another day. Lastly, if we have a zinc deficiency, which is once again a metalloprotease, also known as a collagenase, we get delayed wound healing because we can't break down the type 3 collagen in order to replace it with type 1 collagen, okay? Lastly, for wound healing, what you need to know is that whenever we break our skin or we have any type of wound, that area will always be weaker. We will never regenerate to the full potential it once was. That's something that they like to ask. Overall, this completes our chronic inflammation and wound healing. If you have any questions, please let me know.